Hello, my name is Bradshaw. I'm going to put on some hand sanitizer and provide privacy. I'm a student nurse. I've got some orders here to draw blood. I'm going to draw it out of your central line there. After drawing blood, it's recommended that we go ahead and change out the cap and go ahead and change out your bandages. Normally, we would only change out your bandage every 7 days if everything looked fine. We'd clean it off. We'd change it out sooner if we saw drainage or any blood or anything underneath the bandage, or we would change it out every 96 hours if we're running lipids, which are kind of a fatty substance that will give you for feedings if you couldn't eat. Or we'll change it every time we do a blood draw. So today we're going to do a blood draw, so we're going to go ahead and change out the cap. Do you have any questions for me? No? Would you mind telling me back why we would change out your bandage? Okay, and the cap, why would we change that out? Is the blood draw or contamination or anything like that? All right, good job. You have any questions for me? No? So I'm going to go ahead and give you the mask here. And this mask will help you from breathing on this site as I clean it. And then I'm going to go wash my hands. When I come back, I'm going to have you look out the window just so that you're not looking over, not tempted to look down or breathe on the site as I'm changing it, okay? All right, I'll be right back. Alright, so I'm going to raise up your bed here, and I'll have you go ahead and take a look out that window. You can still talk to me if you need anything or have any questions. I'm going to put the side rail down on this side. I'm going to get a little bit of hand sanitizer on my hands here. And then I'm going to go ahead and put on some protective equipment. And this is mostly to protect me, protect you from me. It's going to keep me from breathing on your central line or anything like that. And hopefully will keep you from getting any kind of infection and keep you healthy. And I've got a little gown here that I need to put on. And if you have any questions at all or feel uncomfortable, just let me know before we get too far into this process. You're okay like that? All right. Yeah, it looks like it's a little cloudy today. All right. I'll go ahead and grab a pair of gloves here. Alright, so this is going to be some cold alcohol here. I'm going to use that to wipe the outside of this bandage, and hopefully that'll help loosen up the stickiness of it so it'll peel away a little bit easier. And then I'm going to peel from the edges towards the middle, and that'll keep me from pulling this out or dislodging it in any way. Sorry if it pulls on your skin a little bit. And I'm going to anchor that down as I pull it out. Alright, I'll go ahead and examine this. I didn't see anything when it was on your skin, and it still looks pretty clean here. I would note if there was any drainage or anything like that, color consistency in my notes. So I go ahead and get rid of these gloves. And if you keep looking out the window, you're doing a great job there. That way you're not breathing on this. I'm going to pull out some gloves. And go ahead and open this up. Like that. All right. So, okay. So the first thing I'm going to do is I'm going to clean you off here. I'm going to break this seal. You'll see it get wet underneath. And then I'm going to go ahead and do a back and forth motion and start wiping. And with this hand, I'm going to go ahead and hold this in place so I don't dislodge it. Going back and forth. And clean that off. And then I'll go ahead and grab this and put my dirty hand underneath it. I'll rip it open from the top. Pull this out. Go ahead and hold over here so I don't touch the skin or areas that I just cleaned. And I'm going to get rid of any blood that's leaking around this tube. Get it nice and clean. And then go ahead and stick this on. Hold it in place there. And this comes with a little thing that I need to put the date, time, and my initials on. It's a little piece of tape. Stick on there, just like that. All right, are you doing okay? All right. I'm going to move some of this stuff over to the garbage here. I'm going to go ahead and take off these gloves. You mind passing me a pair of clean gloves there? Go ahead and put on a little bit more hand sanitizer. And we're going to go ahead and do that blood draw. So, clean gloves here. I've got everything I need for the blood draw. And then right after I do that blood draw, I'm going to go ahead and change off the cap. So first thing I'm going to do is take off this tape here. Get rid of that. And I'm going to clean off the hub for 15 seconds. Alright, using good friction there, get that nice and clean. So here's my flush. I'm going to carefully take off the cap without touching the end of either of these. Go ahead and put it in. I will unclamp that. And then using the push method, I'm going to go ahead and push in 10 milliliters. And then after I've infused that, if there was any kind of fluid running, I would have paused that fluid for 2 minutes before doing any of this. Then I'm going to go ahead and withdraw 5 milliliters to get back blood. And this is going to be my discard blood. After pulling it back, I'm going to go ahead and clamp it. Make sure no air gets in there. This is my discard blood. I then have a new syringe that I open up. Without touching the ends with anything, I'll go ahead and put that on. And I will go ahead and pull it out, or clamp it. And I will pull out 5 milliliters of blood to be infused in that tube. Clamp it again. And carefully, without touching the ends of that, I'll grab a new piece of tape to hold that up in place. And then the hospital has a little adapter piece that I can screw this into, and it will let me put the blood into the tube safely without poking myself or anything. with putting the blood in here, I would put it with the date, the time, the patient's name, and my initials on it. Going back over here, so now that I've got the blood draw, I need to take this piece off, and I'm going to go ahead and change the cap. Before I do that, I'm going to grab my new cap, open it up, take a normal saline syringe, carefully without touching the top there, and without touching the end piece here, put it in, and I'll go ahead and flush it. Okay. Then I'll take this piece off. And then I can go ahead and take this off. I'm going to discharge it. I'm going to grab alcohol wipe and clean the top of here, making sure there's no blood residue there for another 15 seconds. And good friction, that's cleaned off. And then without touching the tip of it or the tip of that, I'm going to sterilely put them together. Alright, I'll go ahead and unclamp this using the push method. I'm going to go ahead and put in the 10 milliliters of normal saline. Doing the push method, and my last push, I'm going to go ahead and clamp it. Take that off. Keep it up. This is my heparin. Without touching the end there, taking off the clean piece there, I'm going to go ahead and attach my heparin. I will open this up again, and I will flush 5 milliliters of heparin using the push method again. And once again, when I get to the end, I will clamp it as I push, keeping pressure in the line. The heparin will keep it locked there. I will then grab another clean piece of tape, and I will go ahead and secure that to the patient there. Gather up all of my supplies, put up the side rail here, making sure that the call light is in with reach. Patient can then move their head back. Again, I'm going to go ahead and lower the bed to the lowest position. Do you have any questions? You feel okay? I'm going to go ahead and have you remove your mask here as soon as we get down, unless you want to keep the mask. So we'll go ahead and remove it for you. I'm going to gather up my supplies, perform hand hygiene, document this procedure, and then I will be back to check up on you.